My name's Rose, and I'm here to talk to you guys about a subject that, well, quite frankly, nobody wants to talk about. This subject is something that is scary and overwhelming, and 9 times out of 10 when it's brought up, it's due to the fact that something bad has happened. I want to change this perspective. I want people to have more of an open mind to what it is, how the rate is growing, and ways that we can prevent this. Today we're going to talk about suicide, and a lot of us are affected by this, whether it be emotionally, mentally, physically. Some of us have either known someone, read about it, heard about it, or have actually attempted it ourselves. This is something that has been on the rise for many decades and is now being more and more talked about as well as publicized. We're going to look at some of the facts found on the Center for Disease Control's website, as well as a survey that they done and a personal experience. According to the CDC, suicide is the 3rd leading cause of death in young adults, and this is in groups ages ranging from as young as 10 years old to 24 years of age. On average, 85 Americans will attempt suicide every day. Now, this is going to result in approximately 6,700 lives that are lost each year because of suicide. The top 3 methods found in young adults that attempt suicide is 45% will use firearms, 40% will use suffocation, and 8% will use poisoning. Now, although females are more likely to attempt suicide than males, males are actually 4 times more likely to die from the event. But the CDC has also found that more and more youth are surviving committing suicide, and the effect that that has can be a lot worse than the actual event of suicide itself. A nationwide survey that was done in grades 9 through 12, not only in public but private schools as well, shows that 16% of students had thought about committing suicide. 13% had actually came up with a plan to commit suicide, and 8% had actually attempted suicide 12 months prior to this survey. Each year we have approximately 157,000 youth between the ages of 10 and 24 that receive medical care in emergency room departments around the United States of America for self-inflicted injuries and wounds. Now, with the reports of suicidal deaths in the age grade of 10 to 24, 81% of those deaths were males and 19% were females. However, girls are more likely to actually express the fact that they attempted suicide than males are. And this could be one of the factors why males are more likely to die from suicide than females. The CDC has put together a list of some of the risk factors that they believe are connected to suicide. Now, just because I'm listing these risk factors, if you see them in someone, it does not mean that they're going to commit suicide. So please do not take that from this. It just means that this is something that could be affecting them or making them feel overwhelmed to a point where they feel like death is the only option. Some of these risk factors include history of suicide attempts, history of suicide in our families, history of depression or other mental illnesses, as well as substance and drug abuse, stressful life events and loss, easy access to lethal methods, and one of the main ones is incarceration at an early age. Talking to our children and having an open door policy and making sure that we have programs that are not only in our schools but our communities as well are techniques and tools that will help prevent suicide. Now, the good news is that research over the last several decades have shown that with the help of the community resources, tools, and programs, we are able to more grasp the understanding and concept of suicide and work on ways to prevent suicide. Now, like I said in the beginning, a lot of us have either known someone or have attempted suicide ourselves. I myself am both. I have lost 2 of my closest friends to suicide, and I myself had struggled with it from the age of 16 to 24. Within that age range, I was self-mutilating, which is considered cutting, burning, scarring, anything that I could physically cause harm to myself in order to feel like I had some sort of control over what was going on, that I had some control left in my life. Now, throughout this age group as well, I also attempted suicide 10 times. Frankly, I survived because I'm standing here talking to you. But it's something I live with and I deal with every day. So when the CDC says that more and more youth are surviving this and that surviving it is worse than actually committing it, it's honest. It's because it's something you live with the rest of your life. If we don't have this open door policy, if we don't initiate programs in our schools as well as our community where people can openly talk about what's going on, we're steps behind being able to prevent this from happening. I myself had no resources and knew no tools while I was going through this, but I did have somebody who cared. I had a teacher who was there for me, who I could talk to without the fear of repercussions of her telling my parents or going to a mental institution or being heavily medicated till I didn't know who I was anymore because I was so overwhelmed that I couldn't deal with it anymore. Knowing that she was there and having that one person to talk to made the biggest change in my life, because no matter what, she was always there for me. Now, what I want you guys to get from this speech and what I want you to understand is that just being there for somebody, whether it be moral support or actually supporting them through something, by physically doing something for them, you need to make sure that you're there on their terms, because if you push and you push and you push, you will push them away. I know this from experience. I want you guys to have an open mind and to be honestly, openly talking about this subject, as well as helping the community, your schools, and initiating these programs so that kids can get the help that they need. Suicide is a scary subject, and honestly, it's terrifying to think about. And when you've gone through it or you've known somebody, you understand the importance of it. So don't just look at all the facts and the statistics and how drastically they are rising, but think of ways that you can be there to help in the prevention. Don't shut someone out or make them feel like they're less of a person or different because they talk to you about something that's overwhelming them. Yes, it may scare you, but you never know. Something you say can change that person's life. Something that you've said or done for them can save their lives. I hope throughout this speech you understand that suicide is a scary subject, yes, but it's something that we need to discuss openly. We need to have that open door policy, and we need to make everyone feel like we're there for them and that no matter what, we're here to help. Thank you so much, and I appreciate your time, and I hope that from here on out, if you see somebody who is hurting or struggling or upset, you can just say that one nice thing, because you never know. That one nice thing may actually save their life.